Hey there, listeners. I am Joanne Lee Cornish, your truth bomb dropper in the world of weight loss, body composition, and mastering the art of rocking the body you've always deserved and dreamed of in midlife and beyond. Let's cut through the noise. Society tells us it's downhill from now on. We're told to embrace the middle-aged weight gain, embrace the muscle loss and poor health. If that's your vibe, then cool. But if you're ready to defy the narrative, then I am your gal. This podcast is a no fluff podcast where we break down the essential truths of body composition, toss around some practical tips, and dissect the latest trends. I'm not here to sugarcoat. I'm here to show you what's not just possible, but downright probable for you. If you enjoy this content, be sure to click the link in the show notes to explore how we can team up and kick mediocrity to the curb. I offer one-on-one coaching, my ever-popular group coaching programs, and my corporate Educate to Elevate program. Okay, let's get on with the podcast. Enjoy. Hey guys, so I have quite a podcast series that I'm going to record. Today, we're going to be talking about HRT or HGH. HGH is hormone growth hormone. We're going to talk about, I'm just going to run through some of the topics that I have planned out. Body fat, estrogen, and the cortisol lie. We're going to talk about the truth about what's being used off-label for aging and fat loss. We're talking about peptides there. A great look at some of the what the high-level athletes are doing. I'm going to do one on menopause rage, libido lies. I'm going to talk about why you're not losing fat, midlife thyroid, leptin, and reverse T3. I haven't talked about reverse T3. And we're going to talk about filler, fat transfers, and biohacking your face in the midlife. And can you reverse aging or just delay it? What we know, what we pretend to know, and what's absolutely BS. So, off the top of my head, there's some of the topics that are coming up in midlife mayhem. But I want to go back to my bodybuilding roots and go a little bit underground here. And I want to talk about HRT or HGH, what women really need and what no doctor will say about it. So, HRT, Hormone Replacement Therapy, HGH, Human Growth Hormone. We're talking about here when the crossroads many women and gentlemen hit after the age of 40, but especially after the age of, say, 44. And this crossroads is, should I consider hormone replacement therapy? Human growth hormone? Either, or none of them. What most people are given, if they're lucky enough to get anything at all, is often a little too late and a little too little and a little too generic. So if they don't get enough, they get it when they're already dealing with all the symptoms, and they just get a one-size-fits-all approach, which for women does not work. And then when it doesn't work, you do your HRT, it doesn't work, you're having problems with it, and then you're told, well, it's just kind of part of aging, it's a bit of hit or miss. They'll say, well, spoiler alert, it is not, or at least it doesn't have to be. Now, the truth is that for women doing HRT and guys doing TRT, so we're doing hormone replacement therapy and guys doing testosterone replacement therapy, it can be a very, very different experience. So the ladies here are, juggling estrogen, progesterone, testosterone, thyroid. I mean, the nature of a woman's body is that it goes through cycles every day. Every day is a different level of hormones. So, it gets a bit trickier, and it takes more skill, to be honest, to navigate that. Whereas guys, you look at your testosterone, what's your free testosterone? Are you low? Here we go. All right. It's kind of a one jab, just different amounts. So the women are a little bit trickier. But what is happening about the midlife hormone? So for the ladies, around the mid-30s onwards, hormones start to decline. So estrogen, progesterone, and testosterone, they all take a nosedive. But what's not talked about as much and what's not tested is human growth hormone production also decreases and it's decreasing about 15% per decade after the age of 30. The symptoms of all hormonal decline: brain fog, mood swings, dry, crepey skin, zero libido, belly fat that won't budge, loss of muscle tone, and so on and so forth. We're told that this is normal. We're told to accept it, even celebrate it. It's natural. But these symptoms are correctable, but only if you're given the right tools. And here's the kicker: most blood work comes back within range, even when the woman or the gentleman is suffering. So this is because the ranges are built on averages. They're not built on optimal or symptom-free living. So you can be in range and still feel like a shell of your former self. And also they'll say, oh, well, you are in a normal range for a 58-year-old lady. We're like, that's pretty crappy. I don't want to feel like a normal 58 lady. I want to feel like, I did when I was 30. And there's nothing wrong with that. That is talking about being optimal. None of us expect to go back and be like 22. And I doubt many of us would want to go back and be 22. But most women have a pretty realistic expectation or hope of HRT. They just want to get back to being themselves. A happy mind, a responsive body, energetic, able to sleep, turned on by the partner, and muscle tone and a clear, non-anxious mind. I think that's what most women are hoping for. Try to get back to, and the guys themselves, that they want their testosterone replacement, and they're just wanting. They don't think they're going to be some 16-year-old like kid with a, I don't know, acne face and a hard on or something. I mean, they just want to get back to feeling energetic, motivated, more driven. We're all just trying to get back to a place that we used to be, and that isn't necessarily in our teenage years or early 20s. So with regards to HRT, what is prescribed and what actually works? So most conventional doctors will, if they do anything at all. I still have people contact me every single week asking for referrals for doctors. I don't know what's going on in Los Angeles. I have so many people in LA contact me because they can't get anybody to prescribe them, say, testosterone. It's Los Angeles. How is this possible? So they're asking me in Idaho if I can refer somebody to help them prescribe their HRT. They're saying either the doctors won't do it or they're all now guru doctors and it's, $2,000 to walk through the door. Let's get real. So what's mostly happening with conventional doctors, you come up with your own definition of what a conventional doctor is, but they'll offer a low-dose patch or cream for estrogen. They maybe a little progesterone. If you have a uterus, they'll usually start with that. Rarely will they prescribe testosterone, and almost never at a meaningful dose. And I have a real issue with that. So let's talk about the patches for the women, the estradiol patch. Now, personally, I've used the cream and the patch. I have a much better result with the patch. And if you haven't used them, it's the tiny, you don't even know if you've got it on. You change it twice a week. You can't see it. It's amazing. And the patches are, 0.25, 0.05, maybe 1 milligram. I believe there's also 0.33. Progesterone might be a 100 milligram oral tablet taken at night. And testosterone may be a 1 milligram compounded cream, which is, so a lot of the times that's we'll get 1 milligram compounded cream. Now, I did that for a while, 1 milligram. It did nothing. That's often, if the doctors will even prescribe it, they'll give you such a ridiculously low dose and they'll say, well, testosterone didn't work for you because you gave me 1 unit. I'm now taking 4 units and feel fantastic. But there was a time that I took one unit for a long time and it did nothing. So what are the safer ranges? The safer ranges for women, Estradiol closer to 0.75 up to a 0.075 up to a 0.1 milligram patch. Personally, I am a 1 milligram patch. Now, I will say that I've had ladies that started with that and it was too much, and they went down to the 0.05 milligram patch. So that one definitely depends on where your estrogen is to start with, going by your blood work. Progesterone optimal is going to be more like a 2 milligram, especially for sleep. So if you're a lady that's just getting into the throes of it and you just can't sleep, progesterone is like a natural Xanax. I don't even know how else to describe it, and that's actually my doctor's description, not my own. I'll tell you a story about progesterone. My doctor in Los Angeles, very dear friend of mine, you might have heard me talk about him, and he died. He passed away. And I ran out of my progesterone, and I had to find a new doctor to work with. And there was a couple of months there where I didn't have it, and I could not sleep. Oh my gosh, the anxiety came back, the heart rate came back, just wired, couldn't sleep, the whole thing. When I met up with my nurse practitioner, Abby Rose, the lady I work with now, and I got my prescription for progesterone. Now, you're meant to take it at night because it'll help you sleep. I literally, like a drug addict, I popped that pill in the parking lot of Walgreens. I was so desperate to get some progesterone in me, and I felt instantly better. And that's a 200 milligram capsule. And optimal for testosterone is going to be closer to 2 to 5 milligrams a day in a topical form. I take it in a topical form. I use it on the inside of my wrists, inside of my thighs. Symptoms women still have on the low doses. So they're being given HRT, and what's happening when it's not working, when it's just too low? Poor sleep. You're still not getting any sleep. No libido. Weight gain or just weight not shifting. The anxiety is still there. Maybe it's vaginal dryness. And if you're getting checked, then bone loss. Why is this happening? This is happening because the dosages prescribed are based on liability fears, not on optimal outcomes. And when it doesn't work, women are being told that the therapy failed. Well, I guess you just weren't a good candidate. And so women give up. And they think, oh, it didn't work for me. Well, women are a bit more complicated. Our hormones are fluctuating all the time. But you do have to find a health provider that is confident enough to coach you in this. And I think too often they are not confident in this. They're not really even trained in this. And because of that fear, which is actually probably a pretty legitimate fear, right? Because if you really don't know anything about it, you probably shouldn't be prescribing it. Then they err on the side of caution with very low dosages. But that doesn't help the lady who's still suffering the arsenal of symptoms, which is greatly impacting her quality of life. So again, either they won't prescribe. I had one friend who was told that that HRT was just an in vogue thing right now. Really? In vogue? Like female health is going to go out of fashion or something? I personally was told by a doctor in Idaho when I asked about HRT, and they actually said to me, that's very much a California thing. Get that. Totally just disregarded it. Was happy to give me some referrals. I can't knock him, but that's very much a California thing. Just didn't ask me how I was feeling, if I was suffering about it, why So it's getting somebody to prescribe it, especially the testosterone. But why on earth doctors are not willing to prescribe ladies testosterone? I have one lady in Texas, and she had a doctor that told her, oh, well, I see all these women going around with muscular arms. You don't want to look like that, do you? Well, that's nice. For one, maybe she does want to be the woman walking around with muscular arms. Thank you for your judgment. And I don't think TRT is actually going to do that. And he should know that as well. So you got this little bit of a, not a little bit, you got this bias going on with some doctors. And, don't even bother trying to persuade them. Just move on. I'm sure that skill set is somewhere else out there. When it comes to your health in midlife, you haven't got a second to waste. You haven't got a year to waste. You certainly haven't got a decade to waste. So again, the optimal are still safe ranges for women that I would encourage you to discuss is estradiol closer to 0.05 to 0.1 on the patch. However, it can be advisable to start lower than that. The progesterone, awesome. A lot of people start with progesterone. I know the progesterone was the first thing I ever took. A lot of ladies, it's the sleep and low level of anxiety that's going on at first. Everything else is kind of okay. So the progesterone, yes, is a 100 milligram, but you mean the 200 is especially useful, especially for sleep. And the testosterone, which is notoriously underprescribed. We're talking about 2 to 5 milligrams a day. What is the fear? Oh my gosh, you're going to grow a beard. Well, you're not just growing. No. Have I heard of that? Yes, with the ladies that were injecting it in higher doses. Some women do inject lower doses. For me, the cream has worked fantastically, but it had to be in a great enough compounded dose. What then about HGH, human growth hormone? Well, for one, if your doctor doesn't know anything about HRT, you can kind of forget HGH, right? This is very taboo. So human growth hormone is produced by the pituitary, and it is critical for muscle retention, skin thickness, fat burning, tissue repair, sleep regulation. But when's the last time somebody checked your growth hormone? Or if it was checked, what was the last time a doctor actually pointed it out to you and was like, oh, wow, look at this. So again, at the age of 30, production drops significantly. By the time you're 50, you're producing a fraction of what you did in your 20s. So what then happens when human growth hormone is low? Sagging skin, poor healing, increased fat storage, loss of lean mass, poorer muscle tone, bit of a sluggish metabolism. What then happens when we replace human growth hormone? You start to get leaner, especially visceral fat. Skin thickens. Muscle gains improve with training. You don't just take growth hormone, grow muscle. You've actually got to do something to stimulate the muscle. But what happens is you're more likely to get the results of your training. Recovery speeds up for sure. And also, libido and mood may improve. What's the downside of human growth hormone? Well, for one, it's going to be expensive. I don't even know how much it is now, but I'm going to guess it's about $2,000 a month. It requires a doctor oversight. I'll say that again. It requires doctor oversight. Don't just be going tapping some guy on the shoulder in the gym, getting the bros version. It's legal HGH is only prescribed for a diagnosed deficiency or adult growth hormone disorder. So that's when it can get a bit murky. So you might have to get a doctor that is creative. But there has to be a legit deficiency there. You have to have a doctor watch what you're doing on that. The benefits are rather nice. What is it? There's a lot of controversy. People are terrified when they hear human growth hormone anyway. I just FYI, I'm just talking about it, I'm not taking it, but certainly would be nice. But the controversy, and honestly, what would put a lot of women off, myself included, there's a lot of water retention initially. So that is because of it triggering aldosterone. I know the guys don't mind that, but the ladies, if you're going to gain 5, 8 pounds of bloat before the fat starts dropping. That might not be fun. Some people get joint pain and carpal tunnel-like symptoms, and that's because of the water retention that can happen at first. And there's definitely a concern about stimulating the growth of existing cancer cells, which is why you have to do this under a doctor's supervision. Does everything grow? Human growth hormone, you take growth hormone, everything's going to grow. And gosh, if I go back to my bodybuilding years, but actually before my bodybuilding years, so when a lot of this stuff was legal and the guys' jaws used to grow, their jaws would actually grow, the bones would grow. And that's when they were using cadaver growth hormone. And they'd get gaps in their teeth because their jaws had literally widened, so their teeth became more spaced out. That was interesting. I remember I won't mention the name because it's a pretty famous guy. But my dentist in Santa Monica, he was working on one of the bodybuilder's teeth, his teeth. And he'd asked him, are you taking anything? No, I'm not. No. Are you sure? Because, it's going to affect the work I'm doing on your teeth. No, I'm not. No. So this guy was actually getting his gums cut back. The gum, to cut some of the gums away, I guess. I don't know. And no, I'm not taking anything. And my dentist was my friend, and he told me the story. And so he did this surgery on this guy. And the guy's gums grew over his teeth. And the bodybuilder was furious with my dentist. My dentist was furious with the bodybuilder. And because he's like, if he's taking growth hormone and I cause injury to him by cutting his gums back, it's going to cause hypergrowth. And this guy's gums grew over his teeth. How crazy is that? And they're all mad at each other, but it was a bodybuilder to blame. So does everything grow? Only if you're using excessive dosages. This guy, believe me, walking around 300 pounds, he was using excessive dosages. And physiological or moderate therapeutic dose, there's little evidence that normal use of HGH grows tumors. But if you have an active cancer, and that begs the question, how do you know if you have an active cancer? Then you have to stay away because it does, cell proliferation. That's why the skin's so good. It speeds up healing, wounds quicker, recovery, skin. So no, there is a legit risk with taking growth hormone, but especially when these people are taking excessive dosages. And we can increase our own growth hormone by 400% by doing HIIT training, resistance training, getting enough sleep. Growth hormone is produced when we sleep. So if you're not sleeping enough, your growth hormone is going to be low. So right off the bat, we can improve our own growth hormone by sleeping enough and do resistance training with a little bit of HIIT. Can increase our own growth hormone by a lot. So for one, you'd have to find a creative doctor and spend a lot of money. And you can see how there's a little bit of stuff you don't want there. The water retention will put me off right there, but the guys don't care about that. I remember there was another guy, he was, again, I'm talking about excessive dosages here, but his back would go numb. So some type of neuropathy. It was temporary, but yeah. What are the other choices? So a smarter middle ground is the use of peptides. So the peptides that we can use for to stimulate your own growth hormone are CJC 1292 Ipamorelin, and there's testosterone, and there's also 5-amino-1-MQ, which I sell. So go to 5amino.com. Absolutely love that stuff. I probably don't promote that enough on this podcast, huh? Yeah, 5-amino is an amazing peptide, and if you go to my YouTube channel, so at Joanne Lee Cornish, I've posted a lot of videos about 5-amino on there. But anyway, I feel like I'm always plugging something. The peptides, CJC 1295, Ipamorelin, testosterone, and 5-amino-1-MQ. These do not replace growth hormone. Instead, they stimulate your pituitary to produce more of your own. So why would you choose peptides over the real stuff? Well, it's cheaper, fewer side effects. It's a more natural signaling. Your body's creating the hormone. It's not a synthetic replacement. And there's less risk period. I'm not saying there's no risk, but there's less risk period, and there's definitely less risk of overgrowth. But again, that overgrowth really comes with abuse. What can you expect? What can you, if you choose to use these peptides, what can you expect? Better sleep within a few days. Oh, ladies, how many of you would like that? And imagine if you coupled that with the progesterone. Better sleep within a few. Imagine, some ladies are listening to this. Imagine what life is like with sleep. Well, I'll tell you, it's pretty nice. What else can you expect? Fat loss over about 1 to 2 months. It's not going to be overnight. Fat loss over 1 to 2 months, and that's the way you want to lose fat. Anytime you crash weight off, it's coming back. Muscle recovery improves. Skin quality may improve over time. Oh my gosh. Skin quality, probably of all the questions I get, crepey skin, sagging skin is in the top 3. Now, I've done a podcast on, I have done a podcast, right, on loose skin and GHKCU. So GHKCU is a copper peptide that I personally swear by and my skin's absolutely so much better for it. But yeah, I did do a podcast on this. Just go back maybe a month. So you get better sleep within a few days, fat loss over, say, a couple of months, muscle recovery improves, skin quality may improve over time. It's not going to happen straight away. What is the cycle here? So you need to cycle them. So especially this Ipamorelin, that if you're using them all the time, that they're not going to work as well. So you want to use them and stop for a while. They also may not work that well if you're severely deficient. So if you have got the growth hormone of a 200-year-old, you get my drift, then, you can't expect miracles. So it's not going to work as well as obviously the real stuff. And it might not work as well if you're severely deficient. So again, you've got to start by doing your own work. Are you sleeping enough? What type of training are you doing? You've got to help yourself, and these are a supplement. And the drawbacks, they're some of them can be injections, which a lot of people don't like. I know the 5-amino that I sell is not an injection. It is very stable. It's in a capsule form. So what should a woman do? We're talking about ladies here. No, I'm talking about people here. Sorry, let me. You can do nothing and hope the situation gets better, which it won't. Never heard that. I've heard women get used to it. I've heard of women that when they get through perimenopause and they just get into menopause, that they say life's a lot better because they're not in that roller coaster of hot flashes and things like that. But better after all, no. So you can do nothing about it. Your choice, fine. Some people sail through all of this. Knock yourself out. You can accept a minimal underdosed hormone replacement and still struggle because you're working with a doctor that isn't competent enough to dose correctly, or is not willing to listen to what you're dealing with. Or you can find a practitioner who treats based on symptoms, not just labs. Someone who will prescribe the optimized doses of hormone replacement therapy, or for the guys, testosterone replacement therapy. Somebody that is going to monitor your progress with regular follow-up. So ladies, that's really important because our hormones change so much. You can't just go in once a year. At least twice. At first, you're probably going to be going in there maybe every 6 weeks, every 3 months. It's worth it. And a practitioner that maybe uses peptides, is informed about peptides, and maybe, if indicated, maybe prescribe a low dose of human growth hormone. Things to check first. I always say the answer is in your blood work. The answer is always in the blood work. Check your blood sugar and your insulin levels. Check your inflammatory markers, your CRP, your reactive protein, your homeocysteine. Check your IGF-1. This is an indicator of your growth hormone levels. IGF-1, it might be in your blood work. Look for that. But I bet nobody's actually pointed it out to you. And also you want a full thyroid panel. So you want your TSH, your thyroid stimulating hormone, you want your free T3, your free 4, and your reverse T3. Now I'm going to do a separate podcast on reverse T3. It's kind of fascinating. So you need to do your blood work, but things like you need to understand that full thyroid panel, because that can be, throwing some of the symptoms at you. But look for that IGF-1. You might benefit from the bioidentical estrogen, progesterone, testosterone. You might benefit from peptides to support your natural growth hormone pathways. And you'll always benefit from strategic training and protein intake to maximize results. If you're not training, if you're not sleeping, if you're not eating correctly, do not expect HRT, peptides, or indeed human growth hormone to do the work for you. It won't happen. So I guess my message here is there's a lot of stuff out there. It's fascinating. Some of it is bordering on miraculous. Like for me, the 5-amino-1-MQ is a game changer, and the copper peptide, the GHKCU, is a game changer. The BPC-157 for healing and skin also is a game changer. Completely fixed my shoulder. And again, go to my YouTube, Joanne Lee Cornish, because I just did a video on this. There's some amazing, amazing protocols out there right now. You do not need to settle for declining energy, poor sleep, and an unrecognizable body. If you're willing to do the work, then you deserve to work with a health practitioner that will work with you. You need information, you need opinions, and you need bold decisions made by people who treat symptoms. Now, I'm not saying that doctors are trying to fail you here. They're not. Nobody's trying to do you harm or keep something away from you. They're just trained within systems that prioritize disease over optimization. And some of them are very nervous, and maybe there's the legality of it. I mean, of ever prescribing out of the suggested standard range. They're very, very nervous and cautious about dealing with optimization over just treating a disease state. And if a doctor's not comfortable doing this, then give them a break as well. Don't work with them. They're probably fantastic at something else. I think too often we expect doctors to do everything. We expect them to be jack of all trades. My doctor didn't tell me what to eat. He's a doctor. He's not a nutritionist. He's your doctor. Hey, I didn't even mention training. He's a doctor. I think sometimes we give him a hard time, and it's not fair. So if you want to feel strong, vibrant, hormonally supported, you have to get curious. You have to get educated yourself. And sometimes it's worth at least looking outside of the box. And the outside of the box is pretty visible right now. So if you want to help, start with education, start with your labs, start with looking at your blood work, and start asking better questions. If you ask better questions, you will get better answers. Because midlife is not the end, it's the beginning of the next best chapter. And for a lot of people, once they get into the 40s and 50s, their 60s and even their 70s can be the most vibrant decade of their life. Some people, they have more time, they have a little bit more money, they're able to really, live large in their 60s and 70s, even 80s. But the decades where people think it's downhill can actually be the best decades of people's lives. And it's a shame that when people aren't feeling the best and they're doing the work, they're not supported. But I must stress that there's a responsibility to educate yourself. Now, educate yourself through programs like mine, but educate yourself so you can ask better questions. And if you don't like the answers that you get, then you have to educate and source somebody else to work with you. And there are fabulous doctors out there. And like I say, the lady I work with now is a nurse practitioner. Ladies, you can go onto menopause.org and you can look for people that it actually says, the people that actually prescribe HRT. So that is it for HRT versus HGH. We live in exciting times, people. We don't have to. No, HRT isn't for everybody. That's not what I'm saying. And optimizing growth hormone maybe is of no interest to you whatsoever. Some people, ladies and gents, go through midlife carefree. They sail through it. I have a couple of clients, totally fine. Good for them. Why would you mess with that? They're great. Why would you mess with that? But the majority, I mean, I'm going to say 90% of people struggle, and I'm going to say 40% of ladies really struggle to the point that it is life and relationship altering, and it just doesn't have to be that way. I haven't set a date yet, but my next program that's coming up after Type 28 will be Mastering Midlife. I'm going to guess it's not going to be till September, but make sure you subscribe to the podcast, tell other people about it, because once I set the date, I will definitely be plugging it on Midlife Mayhem. I do hope you enjoyed this episode of Midlife Mayhem. Be sure to subscribe and be sure to tell your friends about this wonderful podcast. If you would like more of me, then on social, it's simple, just my name, @JoanneLeeCornish. Also, my website, theshrinkshop.com, where you can see all my coaching programs. There are many, many ways we can work together. Obviously, I do private one-on-one coaching. I do all my programs are in a self-study form, and all my programs are run as a live program at least once a year. I try and do twice, but it usually ends up being once. I have mindset program. I have my awesome 5-day peak week shred that people love. I have the signature weight loss program. I have Type 28, which is advanced weight loss. I have muscle mastery, and I have mastering midlife. So 6 programs that offer a progression to fully understand the body composition through the ages. If you have questions, if you're kind of wondering how I can help you, then simply shoot me an email at jo@theshrinkshop.com. Tell me what's going on, and I'll get back to you and let you know the way I can help. Okay, that's it for now.